Welcome to the spill training of your hazardous drug spill kit. This clip is going to go over the contents of your unit specific spill container. Jackie is going to show you. Inside you have a handout that talks about the procedure. It's just a quick reference, so in the moment you have a reference. There's going to be 4 yellow pads that are for absorbing chemical or biological fluid. There's a red bio bag in case it's for biological fluid, blood, urine, feces, etc. There's going to be 2 face shields, one for the person, the primary nurse, and one for the the helper. There's an extra chemo gown for the helper. There's going to be extra booties for the helper. Inside's the chemo kit. Now this is actually also located in your Omnicell. There was going to be one in your black bin also. We will go over the contents of that kit in the next clip. There's also going to be extra large chemo gloves and medium chemo gloves. The areas that already have these in their Omnicell, we will only be putting in a pair. But for the clinics and areas where they're not contained in their Omnicell, we'll give you a full box just in case it's a large spill. And that's it. Thank you. In your spill kit, you will find the following items. There's going to be a chemo gown that holds everything together. There's going to be a pair of goggles. You're actually going to just throw those away. There are going to be a N95. You're also going to throw that away because we're not fit tested for that. So don't use it. You're going to find an extra pair of booties. So this is for the primary nurse. You're going to find your 2 sets of chemo gloves, also for the primary nurse. And I think they're size medium, so just beware. You're going to have 2 absorbent pads, pillows. Those are going to be for containing the spill. You have your scoop, which is to help pick up the pads. You've got 2 yellow chemo bags, a large one and a small one. The large one is to contain most of the large pads if it's a large spill. If it's a very small spill, you can use the small bag, or you can put the more concentrated materials if it's isolated in that, and then put that in the larger bag later. You have your chemo caution sign, so you're going to put that out. We'll talk about that later. There's also 3 absorbent pads that you'll use for your cleanup. There's a yellow card, which is the card you're going to fill out after you've done cleaning up the spill so that we can let occupational health and safety know. There's also stickers that are for the outside of the container. There's a twisty tie, just so you remember, we forgot, that is to help tie everything together for housekeeping at the end. Okay, and that's what's your spill kit. Thank you.
The nurse walks into the patient room after getting report and has been told the patient has a hazardous drug running via a right upper arm PICC line. She gets closer to the bedside and realizes the IV is disconnected and has dripped and created a large puddle on the floor. The following is the procedure for spill cleanup of hazardous drugs in liquid form. The nurse will first stop the spill, warn others,
I need help with the liquid hazardous drug spill.
isolate the area, and minimize exposure. She will use trained staff for assistance who will grab the spill kit from a designated location on the unit or clinic and get the PAPR cart. The nurse will don PPE in the following order. Wash your hands, apply eye face shield for intact materials, or apply PAPR for powder or liquids. Apply inner pair of chemo gloves to be worn under the cuff of the gown. This should be the smaller pair of the gloves. Apply chemo gown, making sure to fasten the Velcro clasp on the back of the gown. And tie the straps around the waist in the front. Apply the second pair of chemo gloves over the cuff of the gown. This should be the larger pair of gloves. Apply booties, tucking the bottom of the scrub pants into the booties to prevent contamination from the floor. After the nurses have donned appropriate PPE, they will begin the spill cleanup procedure. They will identify all areas of possible contamination and use the caution sign from the spill kit to mark the spill area. If the liquid spill is still spreading, they will place the pillows in a V position on the outer perimeter of the spill to prevent further spread. For small spills, they will place the pillows on top of the liquid spill and allow time for the pillows to absorb the liquid. Place the larger yellow bag in the black bin, securely tucking edges of the bag around the black bin. They will use the scoop to assist with collection of the saturated pillows and place them in the large yellow disposable bag. They will also place the scoop into the large yellow disposable bag. Next, they will wipe the area with disposable towels dampened with tap water using a circular motion starting at the outer perimeter and moving inward for a total of 3 times. The first towel should be completely saturated. The second towel should be moderately damp. And the third towel should be mildly damp. The purpose of this is to get rid of all potential hazardous drug medication on the ground. All towels will be placed into the large yellow disposable bag in the black bin. The following scene demonstrates the procedural differences when cleaning up large liquid spills of hazardous drug or biohazardous material containing hazardous drug. Identify all areas of possible contamination. Place the spill pillows in a V position on the outer perimeter of the spill to prevent further spread. Place the large absorbent pads over the spilled liquid. Allow time for the pads to completely absorb the liquid. For drug spills, place the yellow bag in the black bin, securely tucking the edges around the black bin. For biohazard spills, have a second person in PPE available to open the red biohazard bag and hold it while contaminated items are placed inside. Use the scoop if possible to assist with collection of the saturated pads and place in the appropriate bag. Remember to wipe the area with the disposable towels dampened with tap water using a circular motion and moving inward for a total of 3 times. The first towel should be completely saturated. The second towel should be moderately damp. The third towel should be mildly damp. The purpose of this is to get rid of all potential hazardous drug medication on the surfaces. Then place the used towels into the appropriate bag. All contaminated linens and hospital attire are to be double bagged in a plastic linen bag before being placed into the dirty linen hamper. The following scene demonstrates the procedural differences when cleaning up a hazardous drug powder spill. The PPE required for cleaning hazardous drug powder spills are double gloves, a chemo gown, PAPR, and booties. If a hazardous drug powder spill occurs, or a hazardous drug tablet or capsule becomes broken or crushed and is now in powder form, gently place the absorbent pad over the powder. Completely saturate the absorbent pad using tap water to absorb the hazardous drug. Allow time for the moist pad to absorb the powder. Use the scoop to assist with collection of the saturated pad and place the scoop and the pad in the yellow disposable bag. Remember to wipe the area with the disposable towels dampened with tap water using a circular motion and moving inward for a total of 3 times. The first towel should be completely saturated. The second towel should be moderately damp. And the third towel should be mildly damp. The purpose of this is to get rid of all potential hazardous drug medication on the surfaces. Then place the used towels in the yellow disposable bag inside the plastic bin. The following scene demonstrates the procedural differences when cleaning up hazardous drug intact tablet and capsules. The PPE required for cleaning hazardous drug intact tablet and capsule spills are double gloves, a chemo gown, a face shield, and booties. For intact anti-neoplastic tablets and capsules, use the scoop to assist with collection of items. Place the scoop in the yellow disposable bag. Remember to wipe the area with the disposable towels dampened with tap water using a circular motion and moving inward for a total of 3 times. The first towel should be completely saturated. The second towel should be moderately damp. And the third towel should be mildly damp. The purpose of this is to get rid of all potential hazardous drug medication on the surfaces. Then place the used towels in the small yellow disposable bag inside the black bin.
Go.
The nurse will then remove PPE in the following order and place the items into the yellow disposable bag. Remove booties, remove outer gloves, remove chemo gown by first untying the straps, then pulling the gown from the shoulders until the Velcro is undone, then carefully folding the gown so that the outside and straps are rolled inward. Remove papper hood and dispose of the hood in the yellow disposable bag. Place the papper box, belt, and hose aside for low-level RME cleaning. Seal the yellow disposable bag. Remove inner gloves and wash hands with soap and water. Place the sealed disposable bag into the pharmaceutical black bin, but do not completely secure the lid. Housekeeping will use this container to dispose their items after they clean. Complete the hazardous drug exposure report and make a copy and give it to your supervisor. Also mail a copy to Safety Industrial Hygienist. Place an electronic patient incident report and contact housing to triple clean all surfaces.
After you've cleaned up the spill, you're going to notify housekeeping to come and do their triple clean. You're going to leave the black hazardous drug bin at the bedside or in the area of the spill. You're also going to leave a bio bag if you had to use it for a biohazard spill cleanup. We request that you email your nurse manager and PUG safety with the following information: location of spill, date and time of spill, as well as the chemical name. We request that you fill out the yellow HD exposure report that's in the spill kit, and you're going to inter-office mail that to occupational health, but make a copy for your personal records. We also ask that you do an EPR, a patient event report, or a GPR, and then notify pharmacy and the doctor so that they're aware of the spill and have to recalculate what they can for the next dose. That's it. Thanks for hanging out with us.